Time now for Ask the Expert. February is Heart Awareness Month, and we have some workouts intended to help keep your heart healthy.
Yeah, we have been talking about this all month. Wellness Ambassador David Pritchard here to talk about it as well. Talk a little bit about this heart conditioning. We don't sometimes realize that's the most important muscle.
Exactly.
Right?
I mean, we've been talking about aerobic and cardiac care, and those are things that we think about. We'll get on the bike, do 30, 45 minutes, but that's not the only thing. It's important, as we talked about earlier this month, to combo that aerobic conditioning with strength training. You know, so those two powers be that protects the heart, increases blood flow, circulation. But here's the real reason why it's so effective. It decreases body fat. And then we know lower body fat is going to be a lower risk of heart disease. So there's a benefit to two. More muscle, less body fat. So there's a lot of great things about this program. It's one of my favorite routines I give people because you don't need to go to the gym. You can do it all at your house, very little equipment. And again, the side benefits, Shannon, you'll like, you get a little more toned. You know, the women out there will be like, okay, I'll have to do weights now. It's not just for my heart, but it's great for your legs, great for your back. So I'm gonna demo a couple different movements that can kind of showcase what I'm talking about. Add it into an already existing routine, or just do it on its own right at your house.
And the big thing we want to talk about is safety on doing this, because when you incorporate the weights and movement, sometimes people get a little off balance.
Technique is everything. Level one. I mean, like, the first thing as you're warming up, it could just be a simple jumping jack to kind of warm that body up. Yeah, as you go. But again, what I'm trying to do is get people to be uncomfortable and getting out of that comfort zone. So as I lead you to that next exercise, this is about getting uncomfortable. This step can be from here
What size
to
weight
here.
you got there?
All right, 10 pounds.
Each hand?
So we're going to go 10 pounds, 5 pounds, no pounds, depending on what level you're at. And we're just doing a gradual step up with a curl and then right back down. 10 to 12 reps each leg, but guess what? Great for strengthening and toning the whole body, but again, my heart rate is pounding.
I guess a lot of people maybe wouldn't think of that, but doing weights can actually raise your heart rate.
Absolutely. Again, you're bringing your body to an anaerobic conditioning, which is going to strengthen that heart. The heart is a muscle. The bigger that muscle gets, the better it's going to work for you and be more conditioned. Pumping oxygen, pumping blood flow.
So a lot of times where I work out, I see the people who are doing the weights, and then they don't do any running, and then I see the people doing the running who don't do the weights.
Exactly.
You got to do both.
You got to do both, and that's what that balance is all about. Like just showing you a simple jumping jack, running in place, getting that heart rate up right in your living room are great things that are going to do that. Like this next exercise for your back. You know, you're doing this in order though, so you're getting that heart rate doesn't have a chance to go down. So you're getting into a one-arm row, which is people like, again, Charles, you were saying, you know, the people that are in the weight room only doing the weights.
Yes.
Right.
But then you're going from there down to here, and you're going to a push-up, and then to a mountain climber.
Yeah, those mountain climbers will get your heart going.
Yes.
So you're keeping your body aerobic, and you're keeping your body at that level that your heart needs to get into the shape it needs to get into to prevent heart disease.
Now, are you doing this like 20, then jumping up, waiting 10 seconds? What is the rhythm you're doing?
No, I would like everybody to do it back to back. But if you need to take a little break to be like, okay, I'm going to take 20 seconds, get my heart rate down a little bit so you feel like you can do it without hyperventilating.
Sure.
Absolutely. Take your time in between each sets.
And know where your heart rate is, right? Wear a heart rate monitor to know when you're peaking or where you need to be to get that good workout. Right?
Great question, because resting heart rate, you know, we should be between 50 and 70 beats per minute when we're doing nothing. You can simply just take that by taking your pulse, counting to 6 seconds, adding a 0, and looking at that. If your heart rate, your resting heart rate is 100, 150,
we got issues.
Without doing anything, you definitely have issues. So you got to be careful. So that's why you got to think about the talk test when you're working out and exercising. Can I have a conversation? Can I exercise and not feel like I'm going to pass out? That's why these exercises are important to put into the biking, the treadmill, the walking, because it'll make you better.
Incorporation is what you're saying.
It'll make you better.
You sold me.
Oh, good.
We were already sold.
Have a question for our experts? Email them at asktheexpert@todaystmj4.com. You can also leave a voicemail. We have the number right there for you. Well, just